Welcome everyone, thanks for joining us. I'm Katie Dashiell. Today I'm really excited to be joined by Nicole Pounds, Director of Clinical Outreach at DotCom Therapy. If you're thinking about giving teletherapy a go or just starting out and still have questions, this session is for you. Supplemental Healthcare has been partnering with DotCom Therapy through this COVID-19 transition, and with more clinicians working remotely, schools going virtual, and travelers considering alternatives for the time being, we thought it'd be a great time to share some advice for getting started with teletherapy. Feel free to ask questions as we go, and one of us will get back to you. With that, I'll pass it over to Nicole to introduce herself and share some teletherapy basics.
Thanks, Katie. As she said, my name is Nicole Pounds. I am the speech language pathologist. I'm also currently serving as the Director of Clinical Outreach at DotCom Therapy, which is a teletherapy company. I graduated from Missouri State University in Springfield, Missouri. And initially I provided services on the ground in a brick and mortar school district in person. At a special education preschool, and then I also did some early intervention at that time. In 2016, I joined DotCom Therapy, so I've been providing teletherapy services for about 4.5 years now. I initially got into teletherapy because I just needed more flexibility for my family. My husband and I became foster parents in 2014, and within that first year, had 2 little babies who are biological brothers placed with us. And our oldest son, we've adopted both of those boys now, but our oldest son had a lot of medical issues. And so I was in and out of school a lot, in and out of work. And I was taking a lot of days off because I was in and out of the doctor's office, and we were visiting a lot of specialists that were really far away. And so I just needed something that was more flexible. And so that's kind of how I landed into teletherapy. And then I've just kind of stayed because I love it. Our boys are bigger now, of course. And so I don't need the flexibility quite as much, but I do really love having that flexibility for our family. And then I also just really have fallen in love with the method of teletherapy provision. It's certainly not just a second-rate thing. I think sometimes people think that it's, oh, you provide teletherapy if you can't do in-person, but there's so many benefits to teletherapy that are really unique to teletherapy. And so I just really love the provision of teletherapy services and how collaborative it is. And working for DotCom Therapy, I think that DotCom Therapy is just really innovative and just kind of not afraid to break down barriers and kind of push those limits to see what we can do to better increase access to therapy services. And so I just really love it. And I've had a lot of fun doing it. So I'm glad you guys are all here today. And I hope that this presentation is helpful if you're new to teletherapy, just in providing some foundational skills and basics. So I want to start out just by talking about what is teletherapy. I think with COVID-19 coming to town that we all sort of have a little bit of an understanding about what teletherapy is. We've at least heard of it. But according to the American Speech and Hearing Association, they define it as the application of telecommunications technology to the delivery of therapy services at a distance by linking clinician to client for assessment, intervention, and/or consultation. You may also hear teletherapy referred to as telehealth, telepractice, or telerehabilitation. All of those terms mean the same thing. AOTA, the Occupational Therapy Association, prefers telehealth. ASHA actually prefers telepractice because it incorporates speech therapy and audiology. So you may hear kind of those used interchangeably, but they all mean the same thing and are referencing the same thing. So I wanted to talk a little bit about teletherapy effectiveness. There's a growing wealth of research surrounding teletherapy, and COVID-19 has actually boosted a lot of that as well. And so there's more research and studies going on. But teletherapy, when it's provided appropriately, it is an effective approach to therapy. Studies have shown that teletherapy services and in-person services produce significant and similar results. So when you look at those two methods compared to each other, it is important that you provide good quality teletherapy services, of course, which is why I included the caveat of when it's provided appropriately. We should be striving for teletherapy services to be similar quality, and that our outcomes will be similar to in-person therapy. So it is important that you're providing good quality teletherapy services, but if you are, then they should have significant and similar results to in-person services. So some benefits of teletherapy, it removes location and time restraints as barriers. So no longer are we confined to what specialists are located near a client, or where that client is located. We can really serve clients anywhere because of teletherapy. It just removes that location. It removes time restraints. So if you have clients that maybe are having to travel a long ways to get to therapy services, they no longer have to do that. Because of teletherapy, it can be brought to them, which is a really good benefit. From a therapist perspective, it allows you to work from home, and it allows for that flexibility in scheduling. Like I was talking about earlier, that's kind of what drew me to providing teletherapy services, was just being able to work from home. I can toss laundry in between sessions, or kind of prep for dinner, those kinds of things. And just allowing for that flexibility. You're not really constrained to 9 to 5 hours necessarily, which kind of becomes a liability sometimes because you could provide services all the time. So you do have to set up some boundaries, but it does provide a lot of flexibility for the therapist and for the client when it comes to time. It's very engaging and collaborative. My own son actually receives occupational therapy via teletherapy, and that is my favorite thing. That's why we chose to have him receive teletherapy services instead of in-person services, is because of the nature of teletherapy. I am, as a parent, really empowered to help him improve his skills even in between therapy sessions, because his occupational therapist has taught me a lot about cueing and prompting him and how to show him how to do things. And then I just get to see all of her work. And so it's just super collaborative and engaging for clients. And so that's probably my favorite benefit anymore now that I've provided it for a long time. There are definitely benefits for individuals who have compromised immune systems because they're not having to get out and go to a doctor's office or a hospital to receive services, or a school district. They can stay home where they're not exposed to a lot of germs, so that is a benefit. And then just decreased travel time for the therapist. It just allows you to reach more clients. I know I live in the middle of the United States in kind of a rural area. And I know that there are therapists that work near me that will travel hours every single day for their job. And so because we cut out that travel time, we're able to see more clients and patients in that way, which is great. So as far as getting started with teletherapy, I'm just going to kind of walk through some of the basics so that we kind of have this foundation. You do obviously need to think about the technology that you're using, because teletherapy is based in technology. The technology you're using and how you're using it is important because it will affect the quality of care that you're providing. So you need some sort of device, and then your client will also need a device, so a laptop, an iPad, something like that. Just kind of a note, if your client or you even is using a Chromebook to deliver teletherapy services, the interactivity of that is going to be more limited than other devices, because Chromebooks are just primarily used for viewing content. I know a lot of school districts use Chromebooks and stuff like that, and it's honestly just kind of a less expensive device. So just if you are using a Chromebook, just know that that may be something you experience. You need to make sure you have an updated operating system and that your device is compatible with the platform that you choose. You need good quality internet. If you don't have stable internet connections, then that will affect the quality of care that you're providing. Most platforms recommend a minimum of 3 megabits per second of upload and download speed. You can do free online speed tests, and you can have your client do online speed tests so you have an expectation with them. But that's kind of what most platforms recommend. And then, of course, you'll need to have a microphone and webcam. That seems kind of maybe something that you would expect, but we have had people who have inquired about receiving teletherapy services that then didn't have a webcam available. So make sure that you have both a microphone and a webcam, and your client has a microphone and a webcam. And then there are lots of optional equipment like headphones, which help you be able to hear each other better, a document camera, external webcams. There's lots of different equipment that you can get that can kind of boost what you're providing, but the basics are really just like that device and having the microphone and the webcam. You will need a video conferencing platform. So this is something like Zoom, Google Meet, one of those kinds of platforms to be able to video conference with your clients. Some features that you should look for: does it have the ability to annotate? A lot of platforms do allow you to annotate, which allows you or your client to be able to write on the computer screen, which allows for a lot of interaction during sessions. Can you screen share? So allowing your client to be able to see what is on your computer, which is also important for engagement and activities during session. Several platforms have some sort of chat feature. They allow for remote control of users, so you can give control of your computer to your clients. So there's lots of different features to weigh against for different platforms. And then you also need to consider confidentiality and privacy of the platform. And you may need a business associates agreement or something like that in order to get that feature. So make sure that what you're using is a confidential means of providing services. And then you'll need some materials. So there are lots of different materials. One of my favorite things about teletherapy is that really the internet is at your fingertips. And so you do have a lot of things to choose from. So I've just listed on here, digital materials would be anything that you can pull up online. So that may look like educational games or PDFs. There's interactive PDFs, all kinds of digital materials. There's printed materials, so that may be something that you have printed, like printed flashcards or worksheets or anything like that. You can hold those up to the screen still. I read books a lot that way. You can also use like a document camera or something to show those as well. And then manipulatives will be anything that you have on your side of the screen or that the client has on their side of the screen. So sometimes you know, if the client has a board game, maybe that I also have, we'll both get it out and play a board game, or you can have, you know, host show and tell or something like that and have your clients show you things at their house. So there's lots of ways to kind of make that interactive using physical materials that are in your location or in their location. And then of course you'll need an office or a place to provide therapy, and kind of the two biggest things that you'll want to make sure to watch out for is confidentiality again. Make sure that wherever you're providing therapy, other people don't have access to. So you don't want to provide therapy necessarily in like a coffee shop or something like that. You want to make sure that that it's quiet, that it's private, that it's free of distractions, and that you can really provide a confidential session. And then professionalism, you as a professional, you are providing a professional service and you have a professional relationship with your client. And you don't want that to be hindered because of teletherapy. And so you want to make sure that you have like an office background, maybe you're backed up to like a blank wall, something like that. You just don't want like a pile of laundry behind you or something that would make that would hurt that professional relationship that you have with your clients. Something that's really unique to teletherapy is working with a facilitator. So you will work largely with a facilitator. And there are a couple of different ways that facilitators can act. So there's active facilitation and there's passive facilitation. So active facilitation is where your facilitator is really involved in the session, really actively engaged in the session, kind of acting as your hands and feet. So they may be assisting with setting up materials or assisting with prompting of the student. I know for my son's occupational therapy, she's had me set up whole obstacle courses, and then I follow them around as they go through obstacle courses. They can be kind of as actively involved as you need them to be. And then there's passive facilitation, which is primarily used for students or clients who are a little bit more independent. Maybe they just need some verbal cueing or visual cueing that you can provide yourself across the screen. So in that case, the facilitator would be there to really help them get logged in. And then they would just be there in case of emergency or in case of technology difficulties or anything like that. So just having someone there that can kind of help with that. One thing I do want to say about facilitation is you want to establish expectations with your facilitator early, and you want to have really clear communication with them and really clear expectations lined out for what you need them to do. And this is really important because you are the therapist, the facilitator is not the therapist. And so you need to make sure that the prompting or cueing that they are doing would be what you would do. And so they really do need to be doing those things under your direction. And one way to kind of do that is to just establish those expectations up front and have ongoing communication as your client progresses in therapy. The way that you cue progresses as they start making progress. And so you need to make sure that you're altering what you're telling your facilitator based on what your client needs. And then administering assessments. Just a few things to kind of think about when you're administering assessments. The first is technology. You do need to make sure that you have good quality technology, like I said earlier, good internet connection. Make sure that you can see and hear your client well. This is very important for therapy, but it's also especially important for assessments because if you're administering an assessment, you don't want anything that would hinder your evaluation of the client. And so you might want to do a technology check with the family or client before just to make sure that everything's working properly. And you want to make sure that they know what they need from a technological standpoint too. For example, if you're providing like an occupational therapy assessment, maybe you will need to see the client's hands. And so you might need them to be able to have another camera hooked up or something like that to where you can see that. So just establishing those expectations and really communicating what it is that you need for them to have. And then as far as presentation of assessment materials, you can use digital or printed tests. Pearson and Western Psychological Services both have online assessments that you can get access to. And then you can also use book copy tests. It really is best practice that if you're using a book copy test, you use a document camera or you use like an iPad camera, an external webcam or something like that to show the stimulus material instead of holding them up to the screen, just because you may be a little more wobbly or you may have it too far back and the client can't see it or something like that. So it's just a little bit more consistent if you're using like a document camera or something to present that material. And then the test environment, of course, is important. You want to make sure that you and the client both are in a quiet environment where there's minimal distractions so that the client can really focus on the assessment. And then facilitator roles. Assessments are different than treatment, of course, and so what the facilitator needs to be doing is different. And so again, you just want to establish those expectations and those boundaries up front and really give them a clear list of these are the things you can do during the assessment session, these are the things you can't do during the assessment session, so that they know what is expected of them. And then I just put on here a note that Pearson and Western Psychological Services both have extensive information on their websites about conducting assessments via teletherapy. And so they're a really good resource for, they have best practice guidelines on there. They have research articles on the validity of their tests when they're administered via teletherapy. So they're a really good source of information about administering assessments. And then last, I just kind of listed some tips for getting started and kind of having that first session. So first of all, I would say session prep just is really important, just like you would in person. Get all of your materials out and you would put them in their folders or you would set them out for the day. You want to do the same thing with teletherapy. You might pull up all of the different materials that you're using, all the websites that you're using, especially if you're using like educational websites, anything that's free. If you're using YouTube, anything like that, you want to check for ads and make sure that any ads have played prior to your session, or that all of the ads on the page are appropriate, anything like that, you want to make sure that you check. So really prep for your session. I always recommend too that you plan more than you think you may need, because you never know how quickly you're going to go through things. And so you want to make sure that you have some backup options. And as far as like keeping your clients engaged, just moving through activities sometimes, just like you would in person. If you notice that a student or client is becoming disengaged, you would just want to switch activities and try something new to get their attention. You definitely want to practice prior to your session. And the reason for this is, number one, you want to become very familiar with the technology and how it works so that you can coach your client through technology and how to use it. And just so your session flows well and smoothly. But then you also need to, I always recommend that you kind of do a trial run and actually kind of act out, kind of role play what it is that you're planning to do, especially for your first couple of sessions, because the way that you give directions is different than it would be in person. And the way that you even use materials, you may even use materials to target different things, different therapy targets than you would in person. And so really thinking through, okay, if you pull up this PDF, but they can't interact with it, how are you going to use that to still accomplish the therapy targets that you need? And so just really think creatively about what you're using and how you're presenting it to your clients and the directions that you're giving to make sure that all of that is clear and that it all flows well. And then just be flexible. More than likely, something unexpected will happen. We're dealing with technology. We're dealing with people who are in a different room from us. So just kind of have a game plan for what it is that you would do in those situations so that you can kind of anticipate and just know how you would communicate with a facilitator if that's what's needed, or how you could get them back online quickly if that's what's needed. But just be flexible with it and just know that it's okay if something unexpected does happen, and just kind of roll with that. And then again, just think creatively about how you're using things and what you're using, and have fun. If you are bored providing teletherapy, then your students and clients are going to be bored with your teletherapy, just like in person. So have fun and think creatively and find things that are fun and engaging for your clients, and just be yourself and establish that rapport with your clients just like you would in person. And that can go a really long way. So I just listed kind of on this last slide If you do need more help, I put our website on here, dotcomtherapy.com. We do offer a teletherapy professional development course. We have a materials database and some teletherapy coaching. And then we also provide direct services like direct therapy services. We provide speech therapy, occupational therapy, and mental health counseling. So if you find yourself in a place where you need more support and one of these options works for you or the organization that you're working with, then that may be something that would be a good option, and you're more than welcome to visit our website and reach out to us, and we would be happy to help you learn or support you in any way that you need. So I hope that this was helpful in establishing some of these basics as you get started. And like I said, reach out if you do need more support. But thank you so much for joining me today.